Take two.
Hi, everyone. We just did a little intro, which I realized we did not have our mics on. So we're back. And welcome to the MMAC Minute with Char Mallory.
Episode 3.
Yes. Take two.
I'll do the
3.
countdowns.
There we go. Okay. So before we get started, if you could please like this video, subscribe, hit that notification button, give us a comment. Anything else you can think of, that'd be great.
And thank you for those who have liked, subscribed, and commented so far.
We love them. We appreciate it.
Thank you so much.
Yeah.
The feedback has been fun.
Yeah, it has.
And if you're ever bored and driving by, come by because they're playing in the lobby all day long.
We love it. All right. So today our topic is going to be necks. So I thought this would be a fun one to go over. We get asked about them a lot, and so this would be a good way to address that topic.
Introduce it the way you were going to.
Oh, so necks are important.
The long
and the short of it. Okay, anyway, so we thought we would break it up into 2 major segments. We'll talk about prevention, what you can do ahead of time to get ahead of it. And ahead of the neck aging. Okay. And then how to treat if we've already got some signs of aging going on.
Yeah.
All right. So I will start with some prevention. So we'll talk about a couple of the things that, and by the way, I had some microneedling done a couple days ago. So my face is a little bit swollen. It's not your eyes playing tricks on you. I have a little bit of redness going on and a little bit of flaking. So if something catches your eye, that could be it.
Actually,
it's not bad. That's
really
not
nice.
bad at all. Yeah, it's going to be amazing.
Yeah.
So anyway, back to prevention. So, prevention is the key. What does they say? An ounce of prevention is worth a pound of cure.
Mm-hmm.
Is that what it is? So, so if we can do things to help prevent, it will prevent those signs of aging from developing fully. You'll be glad. So, what we can do is some of our favorite things are going to be skin tight. So skin tight uses red light and a little bit of heat to help tighten up that skin. So for somebody maybe in your late 20s, early 30s, 40s, or if you are genetically blessed and you don't have a ton of signs of aging in your neck, you can do some skin tight. It feels wonderful. It's not a hard one to do. It's very easy. Very
and no
quick.
downtime.
No downtime. Pretty comfortable. So that one is a good one to do. We could do the whole neck. We do kind of like jawline to collarbone, hit all that skin in there. Sculptra is another really good one to do. Sculptra, we love Sculptra. We talk about Sculptra a lot. So that's going to be an injectable, and we can just inject all along. We kind of divide up into sections and hit the whole neck area. That's going to increase collagen a ton. So that's a really, really good way to prevent signs of aging. We're talking about laxity, the necklace lines getting deeper, that kind of thing. We can also do, make sure you wear your sunscreen. Yeah. Extend it beyond your face. Do your neck, do your chest. You'll be glad you did.
The face ends here.
Yeah.
So at the bottom of our décolletage, our chest. So cover it all.
Cover it up. And then some other products too. We've got one that we can talk about. I'll let Char talk about that one a little bit.
Oh, it is the neck lift by Image. You guys, and I know this gets the glare and the pretty shiny box. But they actually did tests on submental skin when they were testing this product, and they actually suspended weights from the skin. And they showed in a very short period of time, like I think it was a matter of even 3 weeks, that this skin, using this product twice a day, was able to hold and support more weight just by the use of this product. And they didn't.
Cool idea.
And they didn't use any lasers or anything. And here's a trick. This is kind of funny. It's like, okay, putting stuff on your neck can be a little bit of a awkward pain in the whatever. But if you put a product right here on your back of your hand, and then you just run your hand up your neck, and get the other side, you're going to cover your entire neck. You actually get a little massage, and truly whatever goes on your face or neck should go on your hands. So that's just kind of a fun little trick to put product on.
And this one uses stem cells, but they're plant-based. So that's kind of fun and interesting too. Okay.
And everything's about stem cells right now.
That's right. Stem cells boost that collagen. Boost that collagen. And microneedling. So, speaking of microneedling, I was just thinking if I hadn't been short on time, I should have just extended and done my neck at the same time too. So, microneedling can be a good one for the neck. We're just creating those little channels, kind of aerating that soil, give it a chance to create those micro injuries, which will then heal, giving you younger, healthy looking skin.
And then one thing that we didn't say, and we maybe should have said at the beginning, was we have to not be too hard on ourselves about our neck, because a lot of what happens with our neck is just genetically predisposed. We're given that gift. Different things that, intrinsically we're handed that. So a lot of what's going to happen is just going to happen. And a lot of it has to do with the way our platysma bands are oriented in the neck. And we talked about platysma bands that are last. So if you haven't watched that, just refer back to that one. And we talk all about platysma bands and things we can do about that, about how they are oriented in the neck. The things that we extrinsically allow to happen is, of course, sun exposure. And because the neck is on a vertical 360-degree axis, whatever sun hits any part of our neck affects all of our neck. So even if we've turned our face away from the sun, the sun can still hit the back of our neck and affect our neck everywhere. Nutrition, smoking, all the things, that we can do. But a lot of what happens with our neck is predisposed to happen. So that's why prevention is so important and so much the key. But if you didn't know about prevention and we weren't able to do it when we were younger, all is not lost. We can still slow down that forward aging progress quite significantly by doing some of the treatment options.
Good segue into
treatment options. So I was just last weekend at a meeting in Philadelphia, and it was really awesome. It was about about the upper face, but they also then there were a lot of questions about necks, because it's always the thing. And the provider after provider that was asked and things that came up on the neck, it was all radio frequency. And so, and we have a radio frequency device. We have radio frequency skin tightening as well as microneedling. And when we typically treat face, neck, chest, that is a combination. You get both of those. You get the radio frequency skin tightening, numbing is then applied, and about 30 minutes later, you get the radio frequency skin tightening part of it. And the neat thing about radio frequency skin tightening is radio frequency microneedling is that the puncture, the depth does not need to be as deep as we will do on the face with the non-heat based microneedling, because there's microneedling or the radio frequency energy that continues to shoot that energy down into the skin more deeply.
Yes.
So that's really, but the buzz word for treating necks was radio frequency. And I have to tell you that I have had that same experience personally with radio frequency. And it is the thing that I have seen the most significant changes in my own neck. And I have a genetically predisposed old neck. It just is. It is what it is. So I actually I've been able to do quite a bit to slow it down, but some of it is. Sculptra, again, to treat. Sculptra treating existing neck laxity does not have the same impact as Sculptra in preventing neck laxity. So it's probably not, one of the top on the list, but it's still good. It's just going to be a much slower process. Profractional laser resurfacing, that's another one that can, and that's another one of the buzzwords that was out there. They all talked about multiple modalities to treat neck laxity. RF microneedling, RF, profractional laser, and then neurotoxin. So what profractional is laser resurfacing, and it's a laser that punctures little micro holes in the skin that are deeper than radiofrequency microneedling, deeper than regular microneedling. And so you have these little holes in there in skin bridges. So there's actually been skin removed. So these little skin bridges then grow together, so you have actually less skin. So that is another one. We don't do it at the same intensity as we would do your face, and we do it a little bit less congested, so that you have more unaffected skin, because we have to have unaffected, untreated skin to heal treated skin, okay? And then followed by neurotoxin. And again, we talked about platysma bands in our last video, so refer back to that. But then when we also talked about doing neurotoxin on the necklace lines also. So that's all explained kind of in depth on that last video.
Right.
And really, all therapy is another one. All therapy is ultrasound driven heat, and all therapy offers the most significant skin laxity improvement we can actually achieve non-surgically. And it is a little more painful, a little more uncomfortable. Can be. Everybody has a different, experience.
Yeah.
But it is, if you truly were going to use therapy to its maximum capacity, it would actually be used as a prevention. Also, but just because it's always easier to prevent.
Sure.
But it can also be used to treat. You're just going to it's going to take yearly treatments, and it's a marathon,
and
not
it's
a race.
Gradual. Yeah. Gradual improvement.
Yep.
So it takes a few months to see that. Yeah. And you said something earlier about aging, and it's not that we want to stop aging. It's not that we want everybody's necks to look like they're in their 20s. It's just about feeling like it's not so out of control. Like sometimes people tell me, I woke up and it's like all of a sudden I've just got this old lady neck, and aging is a privilege, absolutely, but we can just kind of like slow down to a point where we're a little bit more comfortable with that. A lot of people say, I don't want to stop aging altogether. I just kind of want to tiptoe. That would be weird, and it doesn't always look quite right. But you can do that gradually. You can feel a little bit more sense of control and comfort with that. Yeah.
And when I read what face, hands, neck, that's how we judge.
Yeah, right.
Age, unfortunately, but it's true.
Yeah.
We can talk about hands on another video.
We should.
I know, hands would be a good one. Yeah. You can do my hands.
We should.
Yeah.
Okay.
We'll do that.
Well, we just had an idea on camera.
There you go.
Perfect.
So, I think that's all we have to say about necks. This is kind of shorter, but necks are important. And often we get so focused. I know I do. I get focused on my face, and really I need to look. Well,
because it's harder to see our necks, right? And then all of a sudden you see a picture or something, you're like, oh, there it is.
Yeah,
there it is.
There it is. Dang. Yeah.
So anyway,
they told me this would happen.
So, okay. So I think we about covered. Oh, so then we have to talk about our week's obsessions. You go first because I got to think of one.
Oh, well, I already mentioned that I was able to go to this meeting, and the first one was last year in September, and I didn't get to that one, and I just would hear about it and with other like injectors that I follow and that kind of thing, and I just was so excited and I made it just an absolute point that I was going to go this year, and I learned so many great new things, and Mallory and I have been discussing them. And I was able to record some of the lectures, so she'll be able to listen to them too. And so my obsession is that I got to go to that. And my thing to be thankful for is that Mallory was here to cover me so that I could go to that and know that I could leave and be gone for a few days, and that all was going to be well.
Are you trying to make me cry? Jeez, I'm such a softie.
So that was really great. So I'm priming her for next year. So I'm already telling her sign-ups are in March.
There we go.
Yeah.
Okay.
So,
perfect.
Yeah.
And you're, I guess that could be both work and personal.
Yeah.
Yeah. Okay. I'm going to steal that, and I'm going to
Well, actually, maybe my personal is, thank goodness I didn't get sick.
You must be taking your wellness injections.
I actually did. I got my glutathione. I gave myself glutathione.
That's the key, is take those injections.
Yeah, it would. Absolutely.
Yeah. Okay. So mine is also kind of a two for my microneedling. You know, it's one of those things that I always tell people you got to be consistent with to see the best results. And I'm so guilty of not making time for myself to do it.
Yeah.
Women, moms especially, I think we're guilty of doing that. So made time.
And it didn't take that long, right?
It didn't. It didn't.
I mean,
it was like, oh, we got an open spot, Joelle and I both at the same time. Let's take advantage of it. Let's do it. And so she microneedled my face, and I gave her a little lipo silhouette. So maybe she'll let us post some pictures of that one too. Yeah. So yeah, it was nice to be able to just take some time for myself, throw on some numbing, finish charting, and get the microneedling done. So I do it for some acne scarring that I still have lingering, the little last bits of it there on my face, and again, prevention, just preventing deeper lines from forming, stimulating collagen, that kind of thing. And it's a good one for me, so I like it a lot. And I guess people keep asking me what my son said about it, because he's very particular about, he noticed, he's very detail oriented. And so the other day, he didn't say anything the first day.
He's almost 3.
He's almost 3, but he's very
aware.
Very aware of when mommy does something. So he didn't say anything the first day, but he was kind of distracted by a new toy. And the second day, we were eating breakfast, and it was my day off. So he goes, Mom, will you do your face? And I was like, what's up, babe? And he goes, nothing. I was like, did you want to ask me something? And he goes, nope. He just didn't say anything. I said, well, I just did, something at work. And he just like pretended like he couldn't hear me. Like,
I want to hear it.
Sorry, I brought it up. I don't actually want to know. It was really funny. So, it is what it is. He's used to it, I guess, by now.
But what are the ducks doing?
The ducks are living their best life. They're getting bigger. The girls are getting bigger. They're very vocal. Eggs. No eggs yet. We got to give them a few months. Yeah. Right. So I'll keep you updated. When I get my first duck egg, you will know. You all will know, and I'll have to taste it, see if I even like them, because we haven't gotten that far yet.
Oh yeah. Yeah.
So yeah. Anyway, thanks for tuning in. We appreciate you guys. Let us know if you have any suggestions for us to cover.
Yeah, there you go. Yeah. What do you want to hear about?
What do you want to know?
All right.
Thanks. Bye.
Continue to give us some feedback. We appreciate it.
We do.
First thing, we don't even have our mics on.
Do you think my face looks pretty right now? Do you think it looks beautiful?
Okay,
are you changing the subject?
I can't get it.
What you got there? Cool. Did you grow those? And tomatoes. Did you grow the carrots?
Oh, yeah.
Those look awesome.
Can you pick tomatoes?
Yeah.